Hello, my name is Asiya Bihasovna. I'm teacher from Dermatovenerology course. Today we again will discuss with you infection diseases of skin, and name of our next lecture will be fungal infection. Fungal infection or mycosis divide for 5 main group. First group we call keratomycosis, second dermatomycosis, then candidosis, fourth pseudomycosis, and last one deep mycosis. But of course, today with you we will discuss only 2 main groups of the fungal infection, which more often you will see in your practice. It is keratomycosis and dermatomycosis. Please look at the beginning of the word keratomycosis. Kerato or keratinocyte. It means that by the definition of word, we can understand that pathological process will located at the stratum corneum of our epidermis. Keratomycosis, it is a group of diseases which transmitted from ill person to healthy person. That's why we can call them anthracnose type of infection. The second group of diseases we call dermatomycosis. Dermis. At the first lecture we discussed with you that in our dermis present different skin supplements or skin appendixes like hair, nail and glands. So in this definition, dermatomycosis, you can understand that for pathological process will go not only our skin, but skin supplements like hair and nails also. Dermatomycosis divide for 4 subgroups. They are epidermophyte, rubromycosis, trichophyte, and microsporous. If we will take rubromycosis and epidermophyte, this type of the fungal infection also will be anthracnosis. Second 2 diseases like trichophyte and microsporous also can transmit it from ill person to healthy person, but also can transmit it from ill animal to person. That's why these 2 diseases also can be like zooanthracnosis type of infection. First of all, we will discuss with you keratomycosis. Keratomycosis, it is a group of fungal infection where main disease we will call like pityriasis versicolor. It means that if patient will come for you, your diagnosis for him mustn't be like simple mycosis or simple fungal infection or even keratomycosis. You should put for him diagnosis like pityriasis versicolor. By epidemiology, pityriasis versicolor you can find mostly at the young men and young women. It means that 25-30 years old women or 25-30 years old men. Etiology or cause of pityriasis versicolor will be fungus, which have name Malassezia furfur. Way of transmission of this disease can be straight way when you have the close contact with ill person, or it can be indirect way, but in this situation you mustn't take the tools of ill person. You can maybe swim from the not clean water, and after that you can see or took this type of fungus for your skin. Sometimes also it can be activation of your own flora. What does it mean? It means that in our body, in body of all health person, present some types of non-pathogenic fungus. So when your immune system go down and you have another disorder or disease, in this situation non-pathogenic fungus can activate, barrier function of the skin also decline, and in this situation you can see the growth of this fungus on your body, and you will identify the clinical signs of disease. So, what you can see at the clinical picture of patient with pityriasis versicolor. First of all, it is localization. Mostly changes in this disease you will see at the upper part of the patient body. It can be chest region, it can be backside, neck region. If it will be women, it mostly should be placed between mammillary gland. Primary lesion for these patients will be macula. Remember, macula is solid type of skin lesion which not elevated, always flat, we can't palpate it. Yes, and macula, it is always change of skin color. So it means that in this disease, color of macula also will can be different. It means that in some patients it will be white color, in some patients it can be brownish color. purple color or others. So it means that in this patient, color of maculas can be different. That's why, again, look for name of disease: pityriasis versicolor. Versicolor means different colors of rash or of macules which will present at the body of your patient. At the upper surface of these macules, sometimes you will see also the small peeling. If you will scratch skin in this region, this peeling will be more visible for you. One of the symptoms which mostly you will see at the patient with pityriasis versicolor, we call symptom coffee with milk. What does mean coffee with milk? For example, if you will look for this picture of our patient, you will see that brown skin like coffee and white colorish macules which present in this region like a milk. Yes, so that's why many authors call this symptom coffee with milk. In some cases, which you will find in our MCQ or when you will pass finally MCQ in your country, you also can identify some questions about pityriasis versicolor. That's why this symptom coffee with milk should be like a keyword for you, which can quicker help to identify the disease. Some of our patients with pityriasis versicolor can feel this not strong, itchy, yes, and the main differential diagnosis of this disease, first of all, should be from the disease which we call vitiligo and symptom leukoderma, which you can see at the patient with syphilis. How do the differential diagnosis between two of these diseases you will understand when we discuss with you diagnostic test which we can use in this situation. First diagnostic test, it is very simple hand test which mostly we use at the practice of dermatology. We call this sample Balzer sample. Balzer is the name of the author who first of all opened this sample. What you should use, you take 5% iodine solution and put for this iodine solution sterile cotton swab. Then this sterile cotton swab, by this sterile cotton swab, you rub the skin of patient where present macules, and solution also should go for normal skin without any changes. After 2 or 1 minute, you will see that macules which present at the body of the patient absorbed iodine solution more better and start to be more brownish than normal skin. Why it happened? Because in these places where you have or see the lesion at patient with pityriasis versicolor, located fungus, yes, and in this place your stratum corneum is more openish, yes, scales here more open. That's why this region will absorb iodine solution more better. So this is sample which we call Balzer sample. We use this technique only for patient with pityriasis versicolor. For other type of the fungal infection, you mustn't do this probe. The second test, which we can use for all type of the fungal infection, this is a main test which can help you to prove your diagnosis. We call microscopy. What does mean microscopy? By the name of this diagnostic technique, you understand that for this procedure, for the doctor will need the microscope. So we send our patient for whom we think have the mycosis to our laboratory. Yes, in laboratory, person took the special sterile small glass and started to scratch the skin at the place where patient have some macules. The scales which doctor will scratch in this region also put for the second sterile small glass. After that, they took this glass, put for this place specific solution, and put this small glass with scales under the microscope. Under the microscope, laboratory person can identify the spores or the parts of the fungus which present in this scale. After that, laboratory person will give for doctor medical card where he will write that at the scales of this patient we identify parts of the fungus Malassezia furfur. And if doctor know that Malassezia furfur it is a fungus who provocate pityriasis versicolor, he will quicker put his diagnosis. That's why, for example, all dermatology doctor should know which type of the fungus provocate different type of these diseases. And last diagnostic technique, which also we can use for patient with fungal infection, We call it wood lamp examination. What does mean wood lamp? Wood lamp, it's a specific lamp, yes, very simple hand lamp with some ultraviolet shining. When we do examination by a wood lamp, it should be dark room where absent artificial light and sunlight also. We took our patient and put for him this ultraviolet light from wood lamp. After this procedure, you will see that skin of the patient where present rash will have specific shining, because all types of the fungus have their specific spores which after ultraviolet light provocate specific light, specific shining. So, for example, Malassezia furfur, or in Malassezia furfur, it will be more red and maybe purple color is shining in this place. So this technique, very simple technique, also can help for us put right diagnosis. This is all information about pityriasis versicolor. All questions about diseases and etc. we will discuss with you in our classes. The second group of fungal infection which we should discuss with you today we call dermatomycosis, and we tell that in dermatomycosis we can identify 4 subgroups. First subgroup in dermatomycosis diseases, we divide like epidermophyte and rubromycosis. We tell that both of these type of diseases can be only entrepreneusis. It means that we took this infection from ill patient to healthy patient. Of course, the way of transmission in this situation can be also indirect. It means that if you will use some cloths or other tools of patient with these diseases, you can infect it by these tools where will present the scales of the patient with parts of the fungus who provocate disease. First of all, let's discuss with you epidermophyte type. Epidermophyte by localization divide for 2 main groups. First, it is a groin epidermophyte. Groin, or also we call it big skin folds or skin folds epidermophyte. And second, it is foot epidermophyte. If we will took the groin epidermophyte type, it's provoked by a specific fungus which we call Epidermophyton flacosum or Epidermophyton bloccosum. By epidemiology, this groin type of epidermophyte mostly can have the patient with moist skin. It should be patient with obesity, because you know that patient with obesity have many skin folds on their body. By epidemiology, also this type of infection more often you will see at the men, in our men, and especially for pathological process in many situations go the groin region of these men. So I will draw or try to draw this region, yes? So I'm not a good painter, but I hope it's understandable. So pathological changes and pathological macules in this situation will located in this place between anogenital region skin folds. The color of macules of this patient will have the bright red color. Your patient always will feel strong itchy in this region. Skin will be moist and sometimes rounds of this rash always will be visible for you. The next type of epidermophyte we call foot mycosis. The second name of this disease also can be athlete's foot. By the name you understand that mostly it is a professional type of diseases in our sportsmen, because they always use maybe not comfortable shoes. Half of their life they live in these shoes. Their soles is always sweat. Yes, that's why foot mycosis or foot epidermophyte, it's like a professional disease for different type of athletes. Of course, present direct and present straight and indirect way of infection, and if it will be indirect way, yes, you can infect it in different swimming pulse. Person who go for the gym also can infected by the scales of person who have this disease, and if their scales will present at the floor and etc. That's why in swimming pools one of the rule always took with you some change shoes. So if we will take foot epidermophyte, in this disease we can see three main stages. First stage we call like squamose stage, and in this stage you first of all will see only small peeling, white colorish peeling between fingers of the patient. At the second stage, which we call intertriginose stage, you will see not only white colorish peeling between fingers of this patient, but you also can see some small fissures. It means that skin of patient lost elasticity, skin start to be broken, and in this region you will see the fissures, and patient will feel the pain when he will moving. And last stage, it is dyshydrotic stage. In this situation, for this all of these signs of disease also will plus primary lesions like a bulla. These bullas after some time will rub. In this place will located red colorish erosion. Patient always will feel the strong pain and moistness of his foot region. Next group of dermatomycosis we call rubromycosis. Rubromycosis also divide by localization for three clinical forms. First of them, it's a rubromycosis of smooth skin. Next one, it is rubromycosis of hands, and also foot rubromycosis. First of all, look for smooth rubromycosis, smooth skin rubromycosis clinical form. Mostly this disease you will identify the patient with dry skin, and the localization of pathological process will be bulging in places of our body. So, bulging in places, it can be buttocks region, it can be mammillary gland region of the women, because these places always rub from clots to for very close clots. Yes, so that's why when we're moving, our skin rub from the uncomfortable clots. That's why in these places you also can see some rashes or changes. So in smooth skin rubromycosis, color of rash can be not a red color. Mostly they will have violet or cyanotic colors, yes. And look, the rounds of this rash will be not like a circle, yes. It means that from the sum of them you will see some places where rounds of lesion will be not visible for you. So like this, not a classical circle. Also, rubromycosis can take or can locate it in our hands, in our foot region. And clinical picture in this situation will be very close for foot epidermophyte. It means that first of all, also patient will see small white colorish peeling between fingers. Then in this region can be present the fissures, then even bullas. How you can do the differential diagnosis between two of these diseases? After microscopic test, it means that different type of the fungus provocate all of these diseases, and you see in this place that the name of this specific fungus. So it means that when laboratory person will took the scales in this and in this and this region, they will identify the parts of some fungus and they will wrote for you that, for example, in epiderm for example, in scale of the patient, we identify epidermophyton blocosum parts or signs, so that's why you will quicker put the right diagnosis. But also, for example, if you can't do the microscopy test for your patient, you should look for the hands and foot region. It means that if for pathological process also go patient hands, it means that lesion or peeling present in palms and in soles, your diagnosis mostly should be rubromycosis, because you see that epidermophyte patient hands don't go for pathological process. We tell that in dermatomycosis situation, not only our skin can go for pathological process, but our nails is also. So that's why in patient with epidermophyte or rubromycosis, you also can see the changes on their nail plaits. Mostly they took the nail plaits which located in our foot region. So, and in this situation, your diagnosis should be onychomycosis. And you see in this picture, and you see in this picture the changes which you will see at the nail plaits of patient. Nail plaits will change the color. Yes, the color of nail plaits will be yellowish, brownish. Yes, and it starts to be more thicker because here will present hyperkeratosis process. Next, two subgroup of dermatomycosis we call Microsporea and Trichophyte. Microsporea and Trichophyte. We tell that this type of the fungal infection can be anthrapanosis, transmitted from person to person, and also can be zooanthrapanosis, transmitted from animal to person. Both of these group of diseases mostly you can find in our children. By epidemiology, mostly you can see in our children, because you know that mostly them love play with different type of animals, and sometimes mom or father can't identify play there or can ill this animal or no. So first of all, let's discuss microscopy. Microspory, sorry. We have two main clinical form of microspory infection. First of them we tell can be anthrapanosis type of microspory, but in real situation, in practice of dermatovenerology doctor, this type of infection is very, very rare. For example, 3 years I work in dermatovenerology department and I still didn't see microsporea which transmitted from person to person. Mostly you will see zooanthrapanosis type of this infection. Provocated this disease by a specific fungus which we call Microsporum canis. Yes, and main animal from whom you can take this disease can be our cats and dogs. So if a cat or dog have this disease and you will have the close contact with him, you also can be infected. Main pathological changes at the patient with microsporea will located on their head region. So, and it will be the situation when you open the head region of the patient and all hairs grow like a normal, but in some place you will see small focus where hairs will broken by one level. Something like this. It seems like it seems like patient took the part of hairs and cut them by one level. But no, patient will tell for you that he didn't do nothing with his hair. Broken of the hair kernel happened after infection of Microsporum canis. So this is a main clinical science for patient with zooanthrapanosis microsporea. If you see or if changes will located at patient skin, in this situation it will be picture like rash, ring in ring. So it means that one circle, and in this circle will present second circle. So we call this symptom ring in ring. So, and if you see this picture at the skin of the patient, you also first of all can think that this is zooanthrapanosis microspory or microspory. Okay, the next type of dermatomycosis infection, Trichophyte. And Trichophyte also will divide for anthrapanosis type and zooanthrapanosis type, which provocated by animals. Anthrapanosis type of Trichophyte infection divide for two clinical form. First of them we will call superficial clinical form, and second chronic. In both of these situations, also pathological process will located at the hair lesion or at the scalp region of your patient. In real situation, very difficult put for your patient superficial Trichophyte diagnosis, because here our hairs will broken by specific way. It means that one hair normal, one hair broken, one hair normal, one hair broken. And we can't see these broken hairs because normal hair always will close broken. That's why if we open the head of the patient, we will never see or identify these broken kernels of the hair. How we can think that it can be superficial type of Trichophyte fungal infection? By the dandruff. It means that patient always will tell something like, doctor, I wash my head 2 times per day, but dandruff again and again return. So in this situation, first of all, or first step, what you should do to check your patient for fungal infection. The second form is more simple to diagnosis because in this situation, at the scalp of your patient, you will see good rounded focus without hairs. In this place will be present only broken hair follicle or only hair follicles of the hairs. So, and we call this symptom like black dots symptom. Black dots symptom. So it means that other hairs will grow like a normal, but in one focus you will see region without hairs and will be visible only black dots. It is the chronic type of Anthraponosis Trichophyte infection. And last clinical form, which you can see in zooanthroponosis type of Trichophyte infection, we call it infiltrative purulent. Infiltrative purulent form of Trichophyte infection. This disease you can take also from the animal, and mostly it should be cattle. It can be sheep, horses, cows, and etc. Pathological changes also can locate it at the patient head region, and main symptom, which you will see here, we call honeycomb symptom. What does mean honeycomb symptom? It means that at the scalp of the patient will present pus formation or very dry pus crust. But if you will take this crust from the each of hair follicle, which will present under this yellow colorish crust, will go pus like this. It seems like you take the honeycomb and cut them, and from each of them will go honey. Yes, so here will be same. Visually, it seems like a honeycomb. That's why we call like this symptom. In many English book, you also can find the second name of this problem. They call it carrion cells symptom. It's the same name of symptom by in Latin language. So carrion cells or honeycomb symptom definition will be equal. So this is all information about dermatomycosis, which we should discuss with you today. All information about treatment, and if something was not understandable for you, we will discuss in our next classes. Thank you for attention. Goodbye.